said, come on. Love my girl. She looking good. Come on.
About the response to the bridge. I was a mayor on 9/11 in St. Paul, and I can tell you that in St. Paul on 9/11, we had no understanding as to what the capacity was in terms of the healthcare system, how many beds we had available during the crisis. We certainly didn't have any measure of communication. We did not have an integrated training system of how do we respond as first responders. I had my police, I had my fire. We had EMS folks in St. Paul and the police department, but the integration of systems was very minimal. And we certainly didn't even have communications capabilities between, in some cases, between law enforcement units. And there's no question in my mind that they weren't existing there between law enforcement and healthcare. So in 9/11, we learned, and what we did is we made a commitment to invest in training, to invest in coordination, and understanding that the healthcare piece of that is an important part of the first responder, the response. I saw it come alive after the bridge collapse. Senator Klobuchar and I flew in the morning, right after. We flew up at 5:30 in the morning with the Secretary of Transportation. We came into a session that was chaired by the mayor. The governor was sitting there. It was the first responders and the various county officials and the health folks, and they were operating at a level of coordination that was stunning to me in a positive way. And I looked at it more with the eyes of an ex-mayor rather than a senator. And I thought this is a very good thing. So my message to my colleagues across the country is that the resources we put into planning, to training, to coordination are well spent. Everyone thinks it won't happen to us. And when it is us, if in fact we've done the things that we've done here, you were able to see a response that was really uplifting in a strange way, the terrible catastrophe. But as I walked the halls of the Senate chamber and the cloakroom right behind the chamber, my colleagues literally came up to me and talked about the response in Minnesota, both the citizen response but the system response. So I applaud you and Joe, we've talked about Mercy. To let you know, my message to my colleagues is that investment in training and planning is important. And thank goodness we made that investment.
Good luck.
Senator Coleman.
Okay, what do you got? Sure.
It goes along with what you're saying about first responders, training, everything. I mean, how are we going to get health care for everybody and stuff like that when we can't even provide for the 30,000 first responders in New York that are sick and dying from pulverized concrete, asbestos, whatever it may be in their lungs and stuff? I mean, would we be able to count on you to reopen a new investigation in 9/11?
Well, I don't think there's a new investigation to 9/11.
Can I ask you what you think about World Trade Center 7 being left out of the commission report?
I think that's black helicopter stuff. I really do.
What about Larry Silverstein?
I'm telling you, I think I'm being honest with you.
The building didn't fall then on 9/11?
I think it is black helicopter stuff.
The buildings didn't fall?
Black helicopter.
World Trade Center 7, man. What about when they
Norm, take them back to the
Guys, we gotta get going.
It
Sorry.
breaks my heart.
reopen the investigation?
I'm Jennifer. You're like,
They got the guns, but we got the numbers. Gonna win, yeah, we're taking